Before I came to the Center of Addiction and Pregnancy, life was not very easy. I did not make things easy for myself.
I was in jail for 3 months for a violation of probation, and I got out of jail in December the 1st, and I knew I had to go into some type of drug program. I'd actually heard about the Center for Addiction and Pregnancy while I was in jail.
I was married. My husband passed away. I had started using after having 5 years clean.
We offer what we call a one-stop shopping model of care. So we try to put all the services that the women are going to need either in our program or here on the campus. So we offer transportation, child care, obstetrical care, pediatric care for after the baby's born and for the other children that the woman might have in her care. In addition, substance abuse counseling, psychiatric referral and consultation and management for women who need or who are dually diagnosed and who might need other services. And in addition, nutritional counseling and methadone maintenance as an adjunct to treatment for women who are opiate dependent.
So often, I believe that when the patients come in, they tell me they have no other place to go. They don't have any other support. They can't find any other programs that will take them while they're pregnant and on methadone, and that this is pretty much their last and only hope.
When I first got to the dorm, I was relieved to get off the streets.
Our groups are centered around things such as self-esteem and relapse prevention. These things are really important when a woman comes onto the unit for the first time. They are usually the core issues that are behind someone using.
And I know that you're really upset right now. I know that you aren't feeling well, but remember, we are here to help you, and we want to do everything we can to make your life better as well as the child that you're currently carrying. They've just been so traumatized that when they come in here and actually see that people really care about them and who they are, it really changes their life because they already have trust issues. A lot of them have no boundaries. So teaching them that, just daily living, what we take for granted every day, you know, when they get here, they have such gratitude for that because they didn't even know how to obtain it. They were hopeless. They were lost, just walking the streets, not knowing if tomorrow they'd wake up. And that's why it's so important, especially for me, to get them in the day they call, the minute they call, because I don't know if they'll make it to tomorrow. We don't have 72 hours to get them in. We only have that moment. So we try to act as quickly as we can.
I was approached non-judgmentally, which I think was very important because of the stigmas associated with addiction, first of all. On top of that, the stigma of being pregnant and being addicted.
I never knew anything about recovery until I came here. You know, I didn't realize the difference between just not using drugs and actually being in recovery. I didn't think there was any difference. So this place is amazing with that. It really is.
There is hope. Recovery is beautiful. And I pray that people who do or are where I was, that they find that place. It's possible. You're looking at a person just, 3 months ago, only resort was, and the only option I thought was death, wanting to die. But when I came here and I sat still, I found out that no, it's not an option. I can live today with my infectious disease, with my bipolar, with being pregnant. I can live today and be happy. Okay.
So let's continue to talk about, obviously the systems are overburdened, and since you brought up an exquisitely good point, and that is that the workforce issue. And you know, here we're talking about the whole thing of healthcare reform and bringing these systems together, and we've got a very fundamental problem in terms of the workforce that's going to feed into these systems, correct, Naksham?
It's correct. And the thing is, the caseworkers themselves need so much more support than they get. They oftentimes are the linchpin on all these varied services that the family are going through. They have to write court reports that have to be done in a certain way, in a certain time frame. They have all these sort of regulations to meet federal guidelines, and they're left with, where's my time to engage with the family? Yeah. You know, and so they feel very overwhelmed. And the support that they need to do this very challenging work is really high, but the system itself has to fight against, our funding depends on certain things being done in a certain time frame, which leaves less and less time for the caseworkers actually to be engaged with the families.
And Fran, as we look at prevention, because a lot of the emphasis, I'm sure, within this new framework of healthcare is going to be in disease management and prevention.
Right.
And how do we get then our ducks in order to respond to such pending changes?
I think that the workforce is there. What we need to do is to begin to combine our talents across the board. The example that you were discussing, Danetta, that you've touched on all different types of prevention, treatment, and recovery all together. And that's part of what we need to do. We also are helping through coalition building, have been very successful because people who live in a community know both the problems and sometimes the solutions better than we do that are working in the system. So by combining some of our leaders on the community, whether that's from our faith communities, from our schools, from our medical communities, and helping to see that the programs that we have to talk to youth and parents and training, since you mentioned training, that's sort of behind the doors of what has to happen and is continuing to happen cross systems. And we as a field, the recovery movement has given us permission to all work together to bring our programs on evidence-based and homegrown promising programs together to approach some of the issues that you're talking about.
If you think about what goes on with the individual who's addicted as well as all those family members, it is a colossal public health problem. We know that children who are growing up in these environments have much higher health care costs while there's active addiction in the family. We know that over a lifetime, if they don't get help when they're young, that they end up with the major chronic diseases, the ones that are rooted in the immune system. We know how to intervene, but we haven't crafted our medical system to recognize this. And as we're talking about the new healthcare system and making sure that this serious health problem is included, we are faced with professionals in that system who have never had adequate education on addiction or its impact on family, especially on developing children. And we have substance abuse workers, prevention workers, treatment workers, and child welfare workers who really and truly don't have an adequate education, either on the healthcare system that they're going to have to function in, or for the child welfare workers, they don't have an adequate education on the subtleties that are so damaging to families from substance abuse. They look at the presenting problem, and that's what they have to react. Those are the forms they have to fill out, is reacting to presenting problems instead of looking at what is the causal issue. And we have a lot to do, and if we don't get it done, that healthcare reform is going to not help us as it must.
But we have to go beyond trainings as well, because caseworkers, they have so many trainings that they go to. Yeah. What we need is real partnerships where they're working, like you were saying, where they're housed in the same place and they're on the same team and they're educating themselves as they're working on the case. That's when it becomes real. One more training isn't going to help anybody. They got to go out there and actually do the work, and then it becomes real to them.
So it's a total multidisciplinary approach to service delivery.
Yes.
Donetta, there are other complicating factors. We have a lot of vets coming back. You yourself are a veteran. Yes. And what can we do in terms of the vet families to really begin to help them address some of the issues that they will be facing?
Well, first of all, we need to start with the whole family. And second of all, we need to be able to give the vet the services on site, immediately to help the whole family to integrate back into civilian life. So it's kind of like a detoxification of the soldier, because when you enter the military, you become another person. You're a soldier. So now you got to find yourself, and then also your family members, you've been away so long, they practically don't know you. So the first thing has to happen is you to have an identity for yourself.